Struggling with stubborn acne that just won't go away no matter what products you use? Here's a shocker. 85% of women over 25 have dealt with hormonal acne sometime in their lives. What if I told you that hormones are not the only thing at play? The problem may actually start in your gut or even your sleep schedule. Crazy, right? Stick around. Today, we're going to uncover the real root causes of hormonal acne, exactly how to treat it once and for all without wasting time, money, and effort on products that don't work. Hi, I'm Dr. Carter with Modern Body Clinic, and we are skincare specialists. In this video, we're going to go over hormonal acne and what you can do about it. Hormonal acne is what it sounds like. It's acne related to hormones, and those particular hormones include estrogen, progesterone, and testosterone. Yes, even for women. How do you know if you have it? Well, two of the biggest things is one is where it's located. Often you'll see this acne in the chin area, along the jawline, or lower cheeks, almost like the beard area. The other thing is the timing. Generally, women will see this more around menstrual cycles, and so those are kind of the main ways you know that you're dealing with hormonal acne. The other thing is that it started later in life, so maybe starting in your 20s, 30s, and 40s when you had no issues when you were a teenager. It's a little bit different than typical acne in that one, it tends to be more cystic and deeper down. Here's what typical acne look like and hormonal acne. See the difference here? Yeah, that's why hormonal acne is so frustratingly unique. Now, some of the root causes might be surprising to you. One of those root causes relate to diet, believe it or not. In fact, high sugar intake of processed foods can spike your insulin level, which can lead to increased androgens, i.e. testosterone, and this can make your acne worse for sure. But also there's something called the gut-skin axis, and basically the stomach is communicating with your skin, and what's going on in your gut is certainly can impact how your skin looks and feels. In fact, did you know that 70% of your immune system is in your gut? A single round of antibiotics can disrupt it for up to a year. Now, that said, inflammation going on in the gut can certainly show up in your skin, and again, that will make the acne worse, because acne does not do well with inflammation. In fact, that's one of the drivers. And one other surprising root cause is sleep. And not just sleep, but sleep and stress, meaning that we just don't have time to recover. If we don't get enough sleep and we're under chronic stress, what happens is our cortisol levels can go higher, and that will do a couple things. And one is going to create more inflammation, and the other thing is that it's going to have the skin cells create more oil production, and that again can make acne worse as well. So now that we have a little better understanding what hormonal acne is and what are some things that could be driving it, what can we do about it? Here's a 3-step plan. First one is let's address nutrition. One simple experiment you can run on yourself is to eliminate or dramatically reduce sugar and dairy intake for the next 4 weeks and see how your skin responds to that. I'm betting favorable, but also reducing processed foods will aid your skin as well. Now, we take away some stuff, what do we want to add? Promoting the right bacteria in our stomachs. Now, the cherry on top would be some supplements. The 3 top ones would be zinc. It does have anti-inflammatory properties, but your skin definitely utilizes this to maintain itself. The other one would be DIM, which not commonly used, but is DIM. This is a product that they take from vegetables and the family of broccoli and cauliflower. Yes, I know. And then another supplement called chastaberry. The last two are really going to help balance the hormones and really clean up types of estrogen that we don't want in our system that are actually doing harm and creating inflammation. Okay, now step 2 is lifestyle modifications. No, seriously, it is important, and a few of the things you can do is one is prioritize sleep. So shooting for 7 to 8 hours of sleep is going to be helpful. Another thing we want to do is manage our stress. So whether that's yoga, meditating, taking a short walk, those are all things that are going to help bring our cortisol levels down, which is we're dealing with hormonal acne. The other thing is making sure our sleep is restful. We want to minimize blue light at night, whether that's turn the lights off an hour or two before you go to bed, or blue light filters. That's going to help with melatonin production. And believe it or not, melatonin is anti-inflammatory as well. Step 3, and this is where we throw the other stuff in, the products. You may or may not have heard of these topicals before, but the first 3 are a starting point for most people. So that would be salicylic acid, that would be retinoids, and that would be benzoyl peroxide. These are really going to help keep the skin clean and healthy. We definitely want to consider those things at the start. Now, what else can we do beyond that, and all the other lifestyle and supplement changes we made already? The next thing would be consider oral medications. Actually, there are a lot of choices, but the ones that are going to have the most benefit for the most people is going to be one, spironolactone. This is actually a diuretic, and often you use it for high blood pressure, heart problems, or people who have liver problems to manage their fluids. But turns out it acts on hormones as well, and so people who use spironolactone for acne typically have pretty good results with it. Now, spironolactone you can't use if you are pregnant, so that would be a reason not to use it. Another class of medication would be birth control pills. Now, honestly, I'm not a big fan of that because it's disrupting our hormones in different ways, but it can be useful for hormonal acne. And now there are a few different medications that are actually FDA approved specifically for hormonal acne. I definitely would lean away if you're over 35 or if you're smoking, because it can increase the risk of blood clots. Keep that in mind. And the last medication is Accutane, and this is a vitamin A product and works pretty well for the vast majority of people. The issue is that it has a lot of side effects. The biggest one is dry skin. Sometimes people get dry lip, joint pain. Keep that in mind. And it is a little bit hard as far as getting it and managing it because it's contraindicated in pregnancy. And if you're of childbearing age, you're going to be monitored very closely if you're on this medication, just because we're so concerned about the risk of birth defects. That is the 3-step plan to get things started. Now, there's one more thing that we definitely want to consider. You may or may not have a skincare routine already if you're dealing with acne, but let me give you a simple one because sometimes simple is better. If you have hormonal acne, I recommend to our clients that they keep it simple with a cleanser, a moisturizer, and an SPF. And these things are going to help minimize inflammation, and the sunblock is going to help decrease inflammation, but studies have shown that it does help with acne in and of it by itself. And a pro tip is don't cleanse more than twice per day. You don't get additional benefit from that. In fact, it makes essential oils from your skin, and that can make the acne worse. Remember, getting clear skin is not just about using the right product, it's about creating balance in your entire lifestyle.